Hi, everyone. Thank you so much for joining us. So I'll hand this over first to Jennifer.
Hi, everyone. Thanks for joining our webinar today, the Global Fund Advocates Network Asia Pacific update webinar. What we're hoping to do today is I think it's been a while since we have had a chance to provide an update to our partners on some of our key recent activities and also some of our upcoming activities and what's in store for us for the rest of the year. So we want to take this opportunity to share some of the work that's been going on and identify ways where we can further collaborate with partners here in the region. Before I go on, just to remind everyone that this webinar will be recorded and will be accessible for sharing after the webinar. So in addition to providing updates, we'll also be sharing key findings and recommendations from a health advocacy ecosystem mapping that GFAN AP has undertaken the last few months. And hopefully that will also help provoke some additional discussions on what other types of stakeholders and partners, both within the health sector, but also beyond the health sectors that we could all be reaching out to for collaborations, especially for the upcoming Global Fund replenishment work next year. Next slide, please, Rachel. Very briefly, this is the agenda for the day. We'll start out with Rachel, the regional coordinator for GFAN AP, providing some updates and helping to introduce the GFAN AP new steering committee, the governing board, and the new host. She'll also be providing some updates on GFAN AP advocacy activities, followed by a brief sharing from one of the GFAN AP partners in Sri Lanka, from Roshan, about the domestic resource mobilization work that GFAN AP has been supporting and partners to conduct in Sri Lanka. After Roshan's presentation, I will share a little bit about the key findings and recommendations coming out from the advocacy and ecosystem mapping exercise we took. We'll make sure we have some time for feedback and questions on both the mapping, but also just a general feedback to GFAN AP on the activities. So that will also include a discussion being led by Rachel on looking ahead for GFAN AP on what's coming up next for the next 6 months and how we can better engage and more effectively work together with all of you as we move towards the replenishment efforts. So with that, let me turn over to Rachel first for some updates on the part GFAN AP. And feel free to, in the meantime, also feel free to introduce yourself to each other in the chat box. It's great to see all of you here today. So over to you, Rachel.
Thank you so much. Thank you, everyone, for joining. And I think, Jen, afterwards, maybe you want to introduce yourself as well. I think people all know us as well. But it would be great just so that people are familiar with the role and the engagement you have now with GFAN AP. So hi, everyone. My name is Rachel. For those that are not so familiar with me, I am the regional coordinator for Global Fund Advocates Network Asia Pacific, and I'm based in Singapore, at least most of the time. Thank you all for taking time out of your busy schedules to join us today. And as Jen has pointed out, we wanted to give you guys an update around some of the work that we've been doing so far in this year, and also an update around the activities that we would have planned for the rest of the year, and seek your thoughts and inputs on better complementing the work of each other, as well as collaborating even further. This is in the context of the upcoming replenishment that will be held next year, the Global Fund's 8th, which is really important given that we don't have that many years till 2030. So I welcome you on behalf of everybody, but I just wanted to also share with you the members of our new steering committee. So can I just ask the members of our steering committee that are right now here with us to please switch on your videos. I'm going to stop the screen sharing right now because I'm getting very confused with the screens that I have at this point. So Blessy, uh, Masaki, uh, I also see, I saw Karun. Karun, would you please switch on your videos? Thank you so much for joining us. Maybe would you want to be able to say a few words around your engagement with our members and introduce yourself? Masaki and then Blessy and then Karun.
Okay, thank you very much, and thank you very much, Rachel, and also thank you very much for GFAN AP. My name is Masaki Inaba. I'm the steering committee member of the GFAN AP from Japan, and I have been working in the Africa Japan Forum as a co-chair, and also Japan CSO Network on Global Health as a chair. Yeah, thank you very much.
Good morning, everyone. My name is Blessy Kumar. I'm based in India. I'm with the Global Coalition of TB Advocates, been a steering member of GFAN AP for quite a few years, and have seen the richness that a platform like this can bring to the communities in our region, and very happy to see the progress that GFAN AP has made in our region as well, and look forward to many, many more successes for our region in addressing the three diseases and beyond. So wishing the new steering committee all the very best, and we hope to be available for support at any time. Thank you.
Thank you so much. Karun, would you like to introduce yourself as well?
Yes, hello everyone. I'm Karen Lama. I'm from India and I work with Youth Voices Count. It's a regional network of young LGBTIQ plus in Asia Pacific region. Sorry, I won't be able to open my camera because I'm traveling. So right now I'm at the airport. Thank you so much, Rachel. Thank you, everyone.
Thank you so much, Karen. And thank you, Blessy and Masaki, for joining. I think the rest of our steering committee members do share their apologies for not being able to join us here. But let me just share with you, at least so that you're familiar with them in a sense, how they look like. This information is also available on our website. Let me just share the link in the chat box so that you can also um, find the information around our colleagues. Sorry, I'm working across screens and it's driving me a bit crazy. So if you would like to also find out more about our terms of references, as well as our other steering committee members, is available on this website. I just want to note that we are very cognizant that at this point we don't have a malaria representative, but the steering committee is committed to actually identifying expertise from the malaria community that will join us in the coming months to work with us around strengthening the responses of the three diseases in our region. So this is a really quick update around the governance of GFAN AP. Sorry, I'm really struggling around sharing screens. So just let me go back to the other screen that I was sharing as well. So for colleagues that are not that familiar with our operations, we are also currently hosted by the International Network of People Who Use Drugs. This is our fiscal host who handles only our administration. They hold an ex officio seat on GFAN AP steering committee, and they are based in the United Kingdom. And this is some of the work that we've been doing. Given the change in our host organization, in the coming weeks and months, we will also be working with the steering committee to finalize an operational handbook that will detail and further some of the operational guidelines that we have identified that needed to be worked upon. This is not to say that we have not had an operational guideline in the past, but that we had followed our previous host organization in terms of operations and in terms of the financial and um, etc. accountability. But then we decided that because of the way that we work differently from input, we wanted to make sure that we also have very strong procurement, for example, procurement processes, as well as even clearer code of conduct practices, as well as conflict of interest and etc. So we're in the midst of finalizing, and we'll be updating everybody around that. And this information will be available very easily on our website. So I'm just going to move in the interest of time to the next part, which is around some of the work that we've been doing this year. So we've released a couple of statements this year, which has been signed on by some colleagues, also which was released with the support of some of our colleagues in the region as well as at the national level. This includes the statement around International Women's Day. This also includes the Malaria Day statement. So we want to thank our colleagues in joining us around that. And we would be looking to release further statements around ensuring that community system strengthening, as well as community-led monitoring, etc., as well as advocacy around Global Fund issues on policies, as well as the replenishment, even further strengthened. We have been working very closely with our colleagues in the region, which include our colleagues in South Korea as well as in Japan, around the recently held Korean African Summit. Sorry for the typo that I neglected the Africa in the middle. So we've been working very closely with GFAN Africa, the Korean Advocates for Global Health Advocacy, as well Advocacy for Health, as well as the Africa-Japan Forum for the recently held Korean African Summit. This is the first of its kind in the region, and we had submitted a statement which was signed on by many of you, and we thank you so much for that. This statement was actually submitted to the Ministry of Foreign Affairs, and that received very good responses. In the final declaration, however, that was adopted by the Korean as well as African leaders, there was one part of our statement and our ask that was actually taken into account. And we would be following this up with a statement that would be thanking our the leaders for and addressing some of the other issues that we hope can be further strengthened going forward. We've been also working very closely. We'll be working very closely with Africa-Japan Forum and our colleagues in Japan for the upcoming TCAT ministerial meeting that is going to be held in August. The TCAT 9, which will be held in Japan next year, will be a very important milestone as well, because that would be probably pivotal to whether or not Japan might actually announce their intention to pledge, which is always one of the opportunities that Japan uses for announcing their pledges for the ministerial meeting. We'll be working very closely with our colleagues from Africa as well as our East Asian colleagues from South Korea and Japan in developing a statement that would be submitted to the ministerial meeting, and we would be also keeping everybody updated around that. But Saki, I'm going to pause at this point to see if you have anything else to add around the TCAT ministerial meeting.
Okay, thank you very much. Yeah, TCAT is a very much important moment, and it is a little different from the, for example, Korea Africa Summit. In Korea Africa Summit, there were no participation from civil society. Of course, there were some kind of submission ceremony or so of the paper and the recommendation paper. But anyway, and in the summit itself, there were no room for civil society. It was very much unfortunate. Also that the FOCAC and China Africa Summit, it is also, and there are no civil society participation. But the TCAT is a little different. And TCAT is a kind of multilateral, the conference system of Africa and Japan and for African development. And we, civil society, will have significant space to participate and direct participate in TICAD, so that we have more opportunity for direct advocacy, so that we would like to use this opportunity with the African and also Asian colleagues. So let's work together. Thank you very much.
Thank you so much. So we'll be keeping everybody updated around some of the plans that we have, and this will be something that's going to be continuing from August onwards till the TCAD next year. So we do want to keep everybody updated. This will be relatively important, or actually utmost important, because Japan is the largest donor that we have from this region to the Global Fund, and we do want to make sure that while we advocate for Japan to contribute to the Global Fund, we want to make sure that the funds do come to the right through the right channels for the right reasons, for the right things. So that will be really important going forward. I'm just Masaki, keep your camera on, because we're going to go on to the next point, which is the FGHI webinar. So just for in case of acronyms, this is the around the Future for Global Health Initiatives, which is now called the Lusaka Agenda. So for more information around the recently held webinar, this is also available on the GFAN AP website. Rico or Jen, could you just share the link on the chat box with people, just in case they would like to check in on that? And one of the things that we are also a little bit confused about, at least from our end, is because it's almost at the tail end of the process already in terms of the Lusaka Agenda. This has huge impacts. Please do not be misled by the name Lusaka Agenda. While it is very focused around Africa, this really impacts the global health architecture and the global health development financing landscape. So at the end of the day, whatever is going to be decided going forward with the Lusaka Agenda will have huge impacts around how global health institutions actually organize themselves, as well as how funds can be channeled through or by donors, and determines largely in part how community and civil societies can or might be able to access funding in that sense. So we have as GFAN AP decided that we would organize a small group of people that would be actually able to focus a little bit more about the broader issues, not necessarily around the Lusaka Agenda, but around the financing landscape in the region, as well as a group of activists, if I would like to call it, because I think it's really important for us to bring the activism aspect of our work back to the foreground. It might not go as crazy as burning tires, but in front of embassies, but we're looking to be able to bring the passion back to the work that we're doing. The next point that I do, Masaki, I'm going to pause here and see if there's anything else you'd like to add around what I've mentioned around the Lusaka Agenda.
Okay, thank you very much. This Lusaka Agenda currently the more how say the updated some the most hot and updated agenda is how to harmonize and those align the Gavi and the Global Fund. So so it is very much affected. This discussion will very much affected until the replacement of the Global Fund. So that we are very much concerned about this discussion. And so that anyway, so we need to focus on this Lusaka agenda and also its internal working group. Yeah, thank you very much.
Thank you so much, Masaki. I'm also really pleased that we do have colleagues from the Seven Alliance that's joined us. So I do see. I don't want to put you on the spot, but I might put you on the spot, Harry. But Harry is with us from the Seven Alliance, and we do have a member on the steering committee from the Seven Alliance that has joined us for this call. The Seven Alliance is the platform that is actually hosting the e-learning hub for the region, Asia Pacific. This is one of the initiatives which is renamed from the CRG platform in its previous life. And I'm not sure, we will be working very closely with the e-learning hub in the coming months around collaborations on thematic areas of the Global Fund, including an upcoming webinar we hope to hold around the 101 on what the Global Fund replenishment means for the Asia Pacific region. So, Harry, I'm not sure if you're listening, or if you would like to just maybe speak a little bit around the Seven Alliance or the e-learning hub, if you would like to do that. If not, if you are there. Sorry, I'm just going to move boxes across the screen. Okay, Harry, are you not there? Okay, if not, then I'm just going to move on. We do have somebody from the Seven Alliance on our steering committee, as I mentioned. She is Sita Shahi, but she sends apologies for not joining us at this point. So I'm just going to then move on to the next slide. So this, I'm going to give the floor then to Roshan. Jen, I'm a bit lost at this point because I don't have the agenda right in front of me. Right? I'm assuming this is now Roshan's
It is correct,
section.
Rachel.
Okay, great. I'm gonna hand this over now to you. So I'm gonna stop my video just so that I'm in my head I'm not sharing.
Thank you, Rachel. But just keep the the slide because it's good to see myself and like talk about the Sri Lankan development today.
Rashawn, is it your volume or is it me? Can you move closer to the mic?
All right. Okay. Just a minute.
Yeah, thank
Is
you.
is it okay now?
Yeah, it's better. Thank
All
you.
right. Okay. Yeah. Okay. Thank you so much. Thanks, Rachel and Jennifer. So uh, with the support of GFAN AP, DUST has been working on building community engagement in diverse sustainability aspect on the national HIV and TB response in Sri Lanka. Um, Thank you so much for supporting Sri Lanka GFAN AP as always. And in 2022, we developed the first ever community-led investment case for HIV and TB response in the country, which serves as a foundation for our sustainability-related advocacy. So that investment case is like always, it's right now it's just using in Sri Lanka because the government is uh, discussing about the social contracting of the civil society organization in the HIV response. So we understand that advocacy on domestic resources for the health and the sustainability of HIV and TB responses need to be targeted at diverse level. While the goal is to push for more allocation for health at the national budget level, the real work need to actually happen at district and provincial level. So that's where like we are working on right now. So we want to push government and the national budget, the treasury to invest more money on the health related matters because as you may know that like the global fund will be leaving us alone in within next few years time. So we need to prepare the country to the sustainable of the HIV response in the country. So together with GFAN AP and with the support of NVF, DAST will be implementing several activities this year to strengthen the community engagement in Sri Lanka, especially in the national budget process. Our objectives are to generate data and develop strategic information to support community advocacy and to build capacity of communities to engage with relevant government authorities to push for increased domestic resources for health, which is bit of a challenge work because as so we are just like facing a very difficult time in terms of financially. So economic crisis is there. We are just like overcoming with that, and so it will be a very big challenge for us. But like we are trying our hard to push the government to like invest more money on HIV and TB response in Sri Lanka. So mainly under this project, what the activities will be like, we will really review the GC6 and GC7 funding request to see what sustainability elements are included and where are we in implementing those activities or interventions. So for this work, we will be hiring a consultant and do a review on GC6 and GC7 funding request and see where are we right now. Um, and under this, so we will conduct a HIV unit cost calculation activity, so which we will have with then the government and the civil society will have like proper idea how much money we need to allocate for HIV response. And also we will conduct national budget training for civil society organizations, because so without having a knowledge on this national budget, so we won't be able to like push the government, so do any advocate related to uh, requesting to allocate more money on HIV response. So we will do a national budget training also. And also, so we are just thinking of doing a letter writing campaigns targeting regional directors of health services, director of national HIV TB programs, and CCM, Ministry of Health, Ministry of Finance, National Treasury, Prime Minister, President, um, so leaders of the political parties also, and some of the key civil society organizations. So this letter writing campaign will be doing with the other civil society organizations who are working on the HIV and TB response in the country. We will also make effort to bring together diverse patient advocacy groups such as cancer communities, NCD communities, and others together to create a joint force to push the increased domestic resources for health in general. So that way, like we will be not alone and we will have like more supportive hands holding with us. Lastly, we appreciate the GFAN AP support and keeping Sri Lanka in mind. Resource for this kind of advocacy is very important. We acknowledge the fact, this fact about the GFAN AP. Um, so we are hoping to do like a really good job here in Sri Lanka, and we will keep update to all in future. Thank you so much.
Thanks so much, Roshan. Jen, I think maybe you let me add one more thing before we continue, because I did realize that I had realized I didn't put this as one of the updates of the things that we've done this year, because in my head this was something that we were supposed to do last day, even though the funding did come in very late. Lastly, I see that you're here with us, so it would be really great to also share some of the perspectives of the webinars that we held collaboratively together as part of this scoping exercise. In terms of the two webinars that we held, one which was held with Indonesia, one which was held with the Philippines, around sharing the best practices of the India Working Group on Global Health Advocacy. And maybe you would like to share around some of the next steps that you might have from your end.
Thank you, Rachel. Didn't realize I was being put on spot, but anyway, I'll try to share. Can you hear me?
Yes, Plessy, go
Yeah.
ahead.
Okay.
Yeah.
So, as part of the work in our region, when the Global Fund advocacy roadmap was shared, we offered, along with many other organizations, and GFAN AP was also one of them, to do a rapid assessment of the situation in our region. And the Global Coalition of TB Advocates, we did a study in 3 countries. It was a very quick, a rapid assessment in India, Indonesia, and the Philippines. And just to look at some of the challenges in our region that the communities were facing in moving forward with our advocacy priorities. And this was done soon after the launch of the Global Fund advocacy roadmap. So that became the background on which this assessment was based. And more or less all the 3 countries, even though there were slight differences, but the findings were more or less the same in terms of advocacy and the community voices being heard by decision makers, policy makers, political leaders. We still had a little way to go. The second major issue that came out was that funding for communities was still a challenge. There was no direct funding to continue with the activities. And the third thing was that there needs to be a lot of capacity building for communities in our region, and also the need for us to work as, not work in silos, but also for all the three disease advocates, activists to come together so that we can really, bring our synergize and bring our strengths together to take this agenda forward. I mean, many of you on the call and also those who are not on the call, we were very grateful for all the input that came, giving us the realities and the challenges on the ground and giving very good suggestions in going forward. So this has been submitted to the Global Fund and also shared in the region and globally. And we hope that this will be taken up and we can look at some concrete actions in the region in terms of increased funding, in terms of bringing community voices higher on the agenda, in terms of facilitating some of the political advocacy, and really supporting people on the ground who are living and affected by the diseases. Thank you.
Thanks so much. Jen, over to you.
Great. Thanks, Blessy. Thanks, Rachel. So I think this is a good segue into my presentation on the health advocacy ecosystem mapping that GFAN AP had recently conducted. And my apology, and thanks, Rachel, for reminding me. Rachel, I need to be able to share screen. But I forgot to introduce myself. So my name is Jennifer Ho. I'm currently a consultant for GFAN AP, largely supporting the operation and administrative side for GFAN AP, but also supporting the thematic webinar series as well. One of my earlier tasks prior to taking on the current role was to support the ecosystem mapping exercise. So that's why I'll be making a presentation on this. Let me see if I can share my screen now. Yeah, okay, sorry. Oh my gosh. And now I'm the one who's confused on how to share my screen. I think I can share. Can I? Oh, sorry. Can you all see the PowerPoint slide?
We can see your entire screen. Yeah, now this is good. Thanks so much, Jen.
Okay. Okay, great. Thanks, everyone. So build very similar to what Blessy had shared. I think well, I'll go through the presentation. I'll give a little bit of background to why GFAN AP decided to do this exercise and a little bit about our methodology. Some of the key findings, I will go in the interest of time. We will be sharing a slide later, and I'll spend a little bit more time talking about the conclusion and some of the recommendations for key way forward. So how we came about, what inspired the mapping exercise was really coming out the COVID-19 pandemic and given the geopolitical tension, that we're witnessing around the region, around the globe, the economic and political challenges. We're really seeing a significant transformation occurring within the communities and civil society landscape. And that also includes, how donors prioritize their development investment, including how they prioritize health. This situation is further complicated by the upcoming elections in various countries in our region, but also in some of the key donor countries for the Global Fund. For our region, the donor countries include Australia, Japan, South Korea, India and Indonesia. And other major elections that will be taking place outside of the region are the US and UK. And as with every election, they have the potential to greatly influence the advocacy ecosystem for donor aid, especially for health financing and priorities, which will impact HIV, TB, and malaria-related policies, programs, and interventions, including even how our own national government prioritize HIV, TB, and malaria, and how fundings will be allocated. And furthermore, just one last point, and I think we're all been experiencing this over the last 10 years and gradually more, is that many national governments in the region have begun to impose stricter and stricter regulations on civic space, affecting the freedom of speech, association, and movement, which really have been impacting how we go about in doing our advocacies. And lastly, given the changes in the advocacy landscape on health due to COVID-19 and I think we're seeing more and more of the need, the critical need to start building on intersectionality of the various development issues, including climate change. We wanted to take this opportunity to see how do we broaden our partnership, building on the intersectionality with the other development sectors, to make our advocacy more effective and more impactful, and really aligning with donors' development agenda as well. Because for some of the donors, health might no longer be one of their key development policy. So what are the other entry points that we could use, and who are the other stakeholders that we need to bring in order to continue to push for what we need for our region and for our communities. So, okay. So again, here, it's really the objective to map relevant community, civil society partners and stakeholders in our region, especially going beyond the health sector, and to identify the gaps, challenges, opportunities for civil society mobilization for the upcoming replenishment, but also, and this links to Roshan's presentation, how GFAN AP can better and more effectively support efforts around domestic resource mobilization for help at the country level as well. Very quickly on the methodology, it was a mixed methodology, desk review of relevant literature and document. One of the key tools that we developed was actually an online questionnaire that we sent out to various stakeholders. So not just civil society and community key population, but we also send the questionnaires to development partners, donors, bilateral, multilateral donors, private sectors as well. That was a really important sector for us trying to connect with. And the information was complemented with selected key informal interviews. Limitation-wise, it was very challenging to get responses from some of the other key stakeholders, including partners outside of the health sector. We did get some responses from partners, especially civil society and community partners who aren't directly working on health issues. But 38 out of our 39 respondents were from key populations, communities, and civil society organization network, either at the country or regional level. We have one respondent from a technical agency, but despite multiple attempts and trying, we weren't able to get any responses back from, for example, private sectors. So that's something for us to think about, especially if we want to be building our advocacy effort with the private sectors later on as well. The questionnaire, again, was designed for respondents to introspect, meaning it was more of a form of self-assessment and their own reflection of their own experience. So it wasn't an assessment externally on their impact. So it was really how they felt about how they did. but that in itself is valuable as well. So very quickly, this is a geographic breakdown of the respondents by country. You will know there's a United Kingdom. That's actually a global network that works on mental health issue with a regional presence here in Asia Pacific as well. Let me go through these. Most of our respondents, they are HIV, TB, and malaria key population-led organizations or network. They're largely also from vulnerable and marginalized population. They might not be a key population for HIV, TB, and malaria. They are from some of the other vulnerable population communities. We have one technical agency, so you can have a closer look later on the detailed breakdown. We did also ask the respondents which area of work that their organizations or network work on, and you will see that groups work on more than just one particular area of work, but close to 88% of the groups that we reach, they do also have an advocacy and policy component to the work that they do, in addition to, for example, service delivery or providing technical assistance to other groups as well. We were really glad to see that 30 out of the 38 respondents that responded to at which level that they carry out their work. That many of, like a large part of our respondents, they are groups at the national level, which it's really important as well. It was good to see that all these respondents. So some groups, if they had identified themselves as a KP and community-led organization or network, we asked them which of the following key and vulnerable marginalized population they serve in leadership position in their organization. And you could see, I mean, pretty much all the organization, they do have key and vulnerable population as in the leadership position. And even and this includes civil society organization and network where they might not, they weren't asked to identify leadership position, but all of their work do aim to support and to serve the key and marginalized populations that we're interested in supporting as well. I'm just conscious of time and I have a lot of slides, so stop me if you want any clarification on anything, or we can take questions afterward. The questionnaire had 3 sections, looking at specifically one on their global fund and global health agenda related engagement. The second part was around their engagement on domestic resource mobilization. And the third part was on their previous experience on engaging in previous global fund replenishment activities. And what we found was, and this was actually very good for us to see, that not all of our respondents, they work on a specific global fund disease specific area. This means we are reaching beyond partners, the traditional partners within HIV, TB, and malaria through this questionnaire exercise that we did. But even if people weren't specific to a global fund diseases, many of these partners, actually all of them, have had a significant level of experience with and about the global fund in these in some of these global fund processes. And these groups actually have at least 2 different types of engagement. So it wasn't as though groups just engaged in, for example, country dialogue processes. Oftentimes it's 1 + 2 or even 3 that they engage with. What's to note in this graph, though, it's also, we also have groups that identify themselves as working on a specific global fund area, maybe not HIV, TB, and malaria, but maybe on health system strengthening, but they've never been involved in any of the global fund processes. So again, that's kind of where the intersectionality and the type of partnership that we could potentially build on as well. So again, what we found was respondents do work beyond the 3 diseases, and this is coming back to the point of how do we reach and build collaboration beyond HIV, TB, and malaria, and where the intersectionality with other disease or other health sectors, including non-communicable diseases, including climate change partner, including groups that work on mental health, aging, and health. What was good to see, though, was that civil society and community organization and network are recognizing the broader, and they're gaining better understanding of this broader global health agenda. Some of the key priority issues that's been at the global level that's being talked about, issues around UHC, health and climate change, digital technology and health financing, pandemic preparedness. Many of these groups have started to incorporate these health agenda issues into their own organizational work or even their own strategic plans. On domestic mobilization, resource mobilization, 27 of the 38 respondents indicated experience or some type of engagement conducting activities relating to domestic resource mobilization. And we asked them questions around what contributed to their engagement, what helped them to want to do this issue, to take on domestic resource mobilization issue, and versus what were some of the barriers to group that weren't able to or that haven't engaged in these type of activities. And you will see that community and civil society awareness and understanding of the issue, it's both it's the top contributing factor to why group decide to take on this issue. But it's also for groups who weren't able to take on this issue, is because they felt they don't have a full understanding of why they should be taking on this issue. So that was a really interesting finding for us, in addition to political commitment and support, enabling environment for CS engagement. Groups talk about the need for strategic information as well, evidence-based advocacy, community advocacy, capacity building and strategy, and quite a number of people actually, respondents mentioned about partnership, having a platform that help facilitate these kind of partnership building and collaboration would be very beneficial as well. And so again, we asked specific, what kind of technical support or recognizing, we did not ask for resource, because our premise was that we all know that resource is a limitation. So beyond the issue of resource need, what additional support that do communities and civil society need in order to engage more effectively in domestic resource mobilization? And this is the results that we saw from the responses. So we asked a very similar set of questions relating to their Global Fund replenishment engagement. I'll skip these next few slides on the Global Fund replenishment engagement and jump straight to what we found in the interest of time, and people can come back to look at this result very quickly. So what we found is, the outcome of the mapping exercise suggests there are 4 key opportunities for collaboration and partnership, and a much more meaningful engagement of communities and civil society in Asia Pacific in advocacy for health in the 3 diseases. And these are, we need to continue to build on the intersectionalities, not just within the health sector, but beyond, right? So health and climate change, health and digital health, like some of these issues, and health and financing that people might not be the most comfortable with, but we need to start looking at where these intersectionalities are. Optimize strategic alignment, enhance support platform for partnership and coordination, support community capacity building on health financing, literacy, and advocacy. So let me just give a little bit of more details on building on intersectionality. For example, so community and civil society organization and network, they often, as we saw earlier, work on multitude of issues that intersect with their priority disease or health concern. So, so for example, they might identify themselves as an HIV-focused organization, but they will also engage in activities relating to UHC, and health financing advocacy. And for malaria groups, for example, right, they might be engaging with groups that work on climate change, and human rights and gender. And so that's kind of where, so these intersectionality can be a fertile ground for fostering cross-sectoral collaboration on health and broadening our allies for help beyond the traditional health sector. And on optimizing strategic alignment. And this actually has to also do with looking at the development partners, their own international developments plan and strategy, and to see where we feed into that. So for example, the Australian's international development framework has a big component on UHC and climate change. For the Japanese, right, there is also a big component on health and climate change. And for the French, there's currently a big focus on One Health, which is looking at the link between human, animal, and environment. And so for our advocacy and mobilization and the messagings that we give to donors, that we need to start looking at what they're interested in and how do we also align our messagings that actually hit the core of their plan as well would be very important. Partnership and coordination, again, based on the finding, GFAN AP is really appropriate place to place this particular role, given its extensive experience in health financing and global fund replenishment, and including domestic resource mobilization. And because partners have continued to ask to have a facilitated platform that help with strategic thinking, that help pushing out materials that they could adapt, coordinated efforts across the region. And that's really where GFAN AP could strategically position itself. And lastly, and I think Leslie alluded to this as well, it's around capacity building for community and civil society engagement. And underscoring all this, it's the resource need as well. Let me stop here. But this report will be launched on the GFAN AP website in a couple of weeks' time, and we will be also setting up a dashboard, an interactive dashboard, where you'll be able to click on specific country and to see who responded and who are the potential partners in your countries that you might be aware of or might not. That you could reach out and collaborate with as we move towards the replenishment effort. Again, thank you to many of you who responded to this mapping exercise and provided your valuable feedback to us as well. Rachel, can I stop here? Back to you.
Great, thank you so much. So we're going to, please don't hesitate to drop any of the questions you might have or comments or feedback in the chat box. I'm just going to move on to some of the updates for the following activities that we have, and some of them might include some of the next steps from this scoping exercise. So this scoping exercise was actually funded primarily through, or actually all of it was through the Global Fund Secretariat in preparation for the 8th replenishment. As you know, the main mandate for the Global Fund Advocates Network Asia Pacific is around supporting and strengthening collaborations of communities and civil society in the Asia Pacific region to advocate for the Global Fund replenishment cycles. That being said, we need to also ensure that while we're doing that, we are ensuring that the funds are channeled to the causes that we feel are the most important and impactful for. So as some of this from the findings, we will definitely be reaching out to many of you to support and to find out how we can strengthen our collaborations further in the upcoming weeks and months till Q3, which is most likely September of 2025, where the next pledging meeting will be held. In the coming days, many of you will be receiving an invitation for a regional meeting that GFAN AP will be holding. It will be the first one in a very long time, given the pandemic, that will be bring people together to strategize on the campaign that Asia Pacific will be working on, complementing the campaign of the Global Fund for the upcoming 8th replenishment. And this will be held on the 13th and 14th of August. So many of you will be receiving the invitations, and I'm going to be sending apologies that we don't have the funding available to invite every and all of you, but we'll try to ensure that if we that we will be engaging many of you by either inviting you in person or sharing the invitation for you to attend virtually. So please look out for the invitations in your mailboxes. The steering committee will be also having its first face-to-face meeting since its formation prior to and after the partners meeting on the 12th and the 15th of August. The meeting will be held in Bangkok and will be sharing more information about this shortly with you. I mentioned already some of the plans that we would be having in terms of the work that we'll be doing around the Korea African Summit, as well as the TCAP Ministerial Meeting. These are some of the main areas of work that we'll be focusing on in the coming months. We'll also be supporting many of you leading up to the end of the year, where there will be World AIDS Day and UHC Day and Human Rights Day in December. And we would be looking for strengthened collaborations as well as partnerships in these areas. I think these are some of the main things that we will be engaging in. I'm not going into much more detail because a lot of the work that we'll be focusing on will actually be determined by many of you in the August meeting that we'll be holding soon. So we'll be looking to engage and have those conversations with you in August or leading up to it. And I think I'm going to stop there now so that we have some time for feedback, as we are running very much short on time. So Jen, over to you.
Thanks, Rachel. And I think we could open, I mean, if everyone's okay, let's take questions and feedback on anything that we just shared for 5 minutes. So please feel free to raise your hand or just turn on your mic and speak to it if you like. Can somebody, Rachel, can you help me check to see if anybody? And
I'm looking as well.
And in the meantime, just to let everybody know that our next webinar will be at the end of this month on the 27th of June. And this will be a joint collaboration with United for Global Mental Health and also the Learning Hub under the 7 Alliance. We will be looking at integrating mental health issues into the Global Fund grant at the country level. It will be a 3-part series webinar. So we'll start out with mental health and the 3 diseases, just a little bit more of a 101. Where are the links? And then looking at within the Global Fund strategy, how to situate mental health issues. And the second and the third webinars will be a more practical look on, some of the existing grants that already integrate mental health into the country grant, whether that's under the HIV, TB, or malaria. I don't think there are any malaria, but I think HIV and TB programs. And we'll be hearing from country partners who have successfully done this and learning from them. So hopefully that will inspire partners to continue to explore intersectionality issues and for us to really help bring mental health issues into the work that we do as well. Do we have any comments or feedback from group?
So while we're waiting for that, Jen, maybe just let me add, and we could do add more if you have any thoughts on this. As part of the August meeting that we would be having around the strategizing of the campaign for the next replenishment for the Asia Pacific, we wanted to make sure that we have the right narrative that actually supports the campaign that we would all be able to have the ownership around. And so one of the things that we would be also looking at would be the impact of the policies that Global Fund has on the work that we do. And that being said, every 3 years, the Global Fund, before it actually makes the decision, the Global Fund Board makes the decision around how much funding goes to each of the countries, we'll have to approve a new allocation methodology. So we would be looking at how there would be influences that we could have or really strong statements that we would need to make to ensure that the Global Fund does make the right decisions around the allocations. This being said, the sustainability transitioning and co-financing policy is also being relooked at by the Global Fund Board, primarily through the strategy committee. And we'll be working with many of you as well as with the representatives from this region on the communities delegation, the developed country NGO delegation, and the developing country NGO. Did I repeat that again? Developed and developing. So 2 separate delegations to ensure that the voices of the Asia Pacific are going to be highlighted in those areas. So if that, I still don't see any comments or questions or any hands raised. Rico, would you want to add anything? If not, then I think we could close the webinar at this point. Jen?
Again, feel free to drop us messages on emails or I think on any of the social media platform that we have. If you have any feedback, comments, and suggestions for GFAN AP, especially with the upcoming replenishment work, if you have additional partners you would like to suggest and for us to reach out to, then that would be really appreciated as well. If there are no comments or feedback from
Can I just
anyone?
ask everybody then to switch on your cameras? Because I realize that we have not done the Asia Pacific thing, which is to get a screenshot of people that have joined us on the call.
I lost